What if your heart has been asking for help, but the signs are so subtle that most people mistake them for normal aging? Heart failure doesn't usually happen overnight. In many cases, the body gives early warning signs weeks or even months before the condition becomes more serious. In this video, we'll explore 7 warning signs every adult over 50 should know, and when it's important to seek medical advice. The first warning sign is shortness of breath. At first, it may only happen while climbing stairs or walking a little faster than usual. Many people assume they're simply getting older or out of shape. But if breathing becomes more difficult during everyday activities, it's important to pay attention. When the heart cannot pump blood efficiently, your muscles and organs may receive less oxygen during normal daily activities. You might notice that you need to stop and catch your breath more often than you used to, even during light physical activity. Shortness of breath can have many causes. A healthcare professional can help determine whether your heart, lungs, or another condition is responsible. Finding the cause early often provides more options for treatment and lifestyle changes that can improve your quality of life. If shortness of breath is new, worsening, or happens during routine activities, don't ignore it. Schedule an appointment with a qualified healthcare professional. The second warning sign is chest discomfort or pressure. It may feel like tightness, heaviness, squeezing, or pressure rather than sharp pain. Some people notice it while walking, climbing stairs, or doing routine chores. Others may experience it even while resting. This can happen when the heart muscle doesn't receive enough oxygen-rich blood. However, chest discomfort can also have many other causes. If the discomfort appears repeatedly during physical activity and improves with rest, it's important to mention it to your healthcare provider. Only a proper medical evaluation can determine whether chest discomfort is related to the heart or another medical condition. Your healthcare provider may recommend tests such as an electrocardiogram, blood tests, or other evaluations to identify the cause. If chest discomfort is severe, sudden, or occurs with shortness of breath, fainting, or pain spreading to the arm, shoulder, neck, or jaw, seek emergency medical care immediately. The third warning sign is swelling in your feet, ankles, or lower legs. While swelling can have many causes, persistent swelling shouldn't be ignored. You may notice your shoes feel tighter than usual or that your socks leave deeper marks around your ankles by the end of the day. When the heart isn't pumping efficiently, fluid can gradually build up in the lower parts of the body because blood doesn't circulate as effectively. If the swelling keeps coming back, gets worse over time, or appears along with other symptoms, it's important to have it evaluated. Your healthcare provider can determine whether the swelling is related to your heart, kidneys, veins, medications, or another underlying condition. The earlier the cause is identified, the sooner appropriate treatment and lifestyle changes can begin. If swelling is persistent or is accompanied by shortness of breath, chest discomfort, or sudden weight gain, don't delay speaking with a qualified healthcare professional. The fourth warning sign is unusual fatigue. If simple daily activities suddenly leave you feeling exhausted, it's worth paying attention. You may find yourself needing to rest after doing things that never used to make you tired, such as light housework or gardening. When the heart cannot pump enough oxygen-rich blood throughout the body, even routine tasks may require much more effort. Many people assume this kind of fatigue is simply a normal part of getting older. However, persistent or unexplained tiredness should not be ignored. Fatigue can have many different causes. Your healthcare provider can help identify whether it's related to your heart or another underlying condition. Getting the right diagnosis early may allow treatment and healthy lifestyle changes that improve your energy and overall well-being. If you're feeling unusually tired day after day without a clear reason, especially along with other warning signs, schedule an appointment with a qualified healthcare professional. The fifth warning sign is a rapid or irregular heartbeat. Some people describe it as a racing, fluttering, or pounding feeling in the chest. These sensations may happen occasionally, but if they become frequent or last longer than usual, they shouldn't be ignored. An irregular heartbeat can happen for many reasons, including stress, caffeine, certain medications, or an underlying heart condition. Pay attention if these episodes occur during light activity, while resting, or are accompanied by other unusual symptoms. Your healthcare provider may recommend monitoring your heart rhythm with an electrocardiogram or a wearable heart monitor to better understand what's happening. Early evaluation can help determine whether the rhythm is harmless or whether treatment or ongoing monitoring is needed. If you experience a rapid or irregular heartbeat along with chest pain, shortness of breath, dizziness, or fainting, seek medical attention immediately. The sixth warning sign is a persistent cough or wheezing. While these symptoms often have non-heart-related causes, they can sometimes be linked to heart problems. Some people notice that the cough becomes worse when lying down at night or improves after sitting upright. When the heart isn't pumping efficiently, fluid may build up in the lungs, making breathing more difficult and triggering a persistent cough. If your cough lasts for several weeks without a clear cause, don't assume it's simply part of getting older. A healthcare professional can determine whether your symptoms are related to your heart, your lungs, or another medical condition. Getting the correct diagnosis early can help you receive the most appropriate treatment and prevent symptoms from becoming worse. If a persistent cough is accompanied by shortness of breath, swelling, or chest discomfort, it's important to seek medical evaluation promptly. The seventh warning sign is dizziness or fainting. Although these symptoms can have many causes, they should never be ignored if they happen repeatedly or without a clear explanation. You may feel lightheaded when standing up, walking, or even during routine daily activities that never caused problems before. In some cases, reduced blood flow to the brain can cause dizziness or even a brief loss of consciousness. If dizziness keeps coming back or happens along with other warning signs, it's important to discuss it with your healthcare provider. Your healthcare provider may recommend tests to identify the underlying cause and determine the most appropriate treatment. Early diagnosis may help prevent complications and give you more options to protect your heart and overall health. If you experience fainting, severe dizziness, or dizziness together with chest pain, shortness of breath, or a rapid heartbeat, seek medical attention immediately. Let's quickly review the 7 warning signs we've discussed: shortness of breath, chest discomfort, swelling in the legs, unusual fatigue, a rapid or irregular heartbeat, a persistent cough, and dizziness or fainting. Remember, having one or more of these symptoms doesn't automatically mean you have heart failure. Many other health conditions can cause similar symptoms. The important thing is to pay attention to changes in your body and avoid ignoring symptoms that are new, persistent, or getting worse. Early medical evaluation can help identify the cause, begin appropriate treatment if needed, and support better long-term heart health. Simple healthy habits such as staying active, eating a balanced diet, managing blood pressure, and attending regular checkups can make a meaningful difference. Our goal is not to create fear, but to help you recognize important warning signs early so you can make informed decisions about your health. If you found this video helpful, please give it a like, share it with your family and friends, and subscribe to Health After 50 for more science-based health education every week. Thank you for watching Health After 50. Stay active, stay informed, take care of your heart, and I'll see you in the next video.